there are caveats and there's enormous benefits of working with industry. I mean, it's a current state where, research funding is diminishing, if not cut off, and harder to do at institutions. And look at COVID and vaccines. That was a hybrid model of success of private, institutional, and industry. So I think that's the reality, and I think that's actually where you get the best results, where you get people with bigger budgets who can help you think about problems. So industry as a whole is an absolute essential partner to innovation for big stuff. And, institutions may do the little stuff. I mean, there's lots of stories. And look at the computer industry.
Right.
Typically institutionally started and then just goes elsewhere and mushrooms. But so if you have a device idea, the caveats are, you give up a lot,
right,
but you gain so much more. If it's something that needs a clinical trial, if it's something, even a feasibility study, you just can't do it without industry and money. I mean, you can raise money to a point, but to do the kind of ecosystem of device to patient use to be FDA approved is a long haul.
Absolutely.
So most big players have, teams that are part of the R&D. So that's typically where you start approaching them. And, it's a pitch. You're probably going to pitch to multiple companies. At one point I wanted to get a business degree. You kind of learn on the fly, but then there's so many resources online that you can look at how to put a business plan together, how to do a pitch. So typically you'd meet with engineers and R&D people and marketing people. There'll be a surrender, right? Your original idea, like, well, no, we think this is better and we can't do this and X, Y, and Z. So there's, maybe it's finding the right symbiotic relationship as opposed to feel like your baby's been taken away, So you will give up, but you will gain so much more. And the relationships with industry, even, if you pitch to different ones and it's not a right fit, they're great contacts for the future.